So many times when we hear about health, we're hearing about those specific health behaviors that we should be doing. So eating right and exercising. And of course, those play a huge role in our health. But when you look at all of the things that contribute to our length of life and our quality of life, those specific health behaviors only contribute 30%. The rest of that 70% are more of those external factors that are different from what we're eating and how often we're exercising.
Eating healthfully and exercising regularly is directly connected to aging well. But those two factors alone aren't enough. When we look at all of the things that contribute to our length and quality of life, those specific health behaviors only contribute 30%. The other 70% relates to external factors. On today's Sound Living, external factors that contribute to healthy lives. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. While we often think our health is determined by what we eat and our level of physical activity, behaviors are only part of what impacts our health. K-State Research and Extension aging specialist Erin Yelland says there are several external factors that influence healthy aging. She says environment, which includes air and water quality, housing, and transit, is one of those external factors.
So with air and water quality, do you live in an environment where there's clean air, or do you live right near a factory or something like that? Do you have clean water that has fluoride in it, or do you live in Flint, Michigan? There's some really important factors there to consider that really contribute to our health and quality of life. And then with housing and transit being the next big category, do you live in a safe home? Do you live in a home that you can pay for, or are you sort of housing unstable where you're not sure if you're going to be able to pay your rent or where you're going to go next month and those sorts of things? And then with transit, do you have the ability to get from place to place? Do you have the ability to go to work or go to the doctor's office?
Another thing is zip code, so that would be where you live geographically?
Yes. There's some very interesting studies that have come out that have basically shown that zip code has more to do with your health than almost anything else. So if we think about comparing, more suburban communities with rural communities, or if you're comparing even urban communities to other types of settings. So think about if you live in an environment where you can't walk safely to school without fear of being shot or mugged or even raped for women, that is an unsafe environment and has a lot to do with your health, because that is a stressful environment. It can affect your brain development and obviously can be dangerous. Versus if you live in a neighborhood like admittedly I do, it's safe. It's safe for my kids to walk to school. My kids play out in the street and in the yards with all of the neighbor kids. And so my kids have it very different from kids who are walking to school in those unsafe environments. And oftentimes those sorts of things can be determined by your zip code.
What about the rural areas? What are some of the, problems that they might face?
So one of the big issues with rural areas is access. And access is a lot bigger than just being able to walk into a grocery store. It also means, do you have the means, the financial means to purchase food, or do you have the financial means to be able to access those services? Do you have insurance, for example? But access can also be things like having broadband internet. So some big things that we see are really under that umbrella of access. Do you have internet access? Do you have access to quality medical care? Do you have access to emergency medical care? And then thinking about more of those social supports, for example, with older adults, is there a senior center in town or even a hospice? What sort of resources are available in your community that may not necessarily be there in rural areas?
And your expertise is in aging, and this might come into play in this sense as well, because I assume that one of the problems is transportation. Older people often have more difficulty getting around.
Absolutely. And that's one of the big things that we have seen in this pandemic, because in rural areas, we have seen previously a lot of ride sharing. So, for example, a friend or a family member would pick you up and be able to take you to your doctor's appointments or to the senior center, or they would send out vans or buses to pick people up. Well, now with the pandemic, a lot of that has stopped. And so we have seen a lot more older adults becoming so socially isolated and basically alone in their homes. And that's one of the big concerns. And if they're not able to drive, or they don't have the finances to be able to afford gas and insurance and a car payment and the whole deal, then we have people who are essentially stuck in place. And we also know that transportation in rural areas can be a big issue, because many of the services that people require may be longer distances away. So do you have the time to be able to drive that distance to go see, a more specialized doctor? Do you have the finances to be able to support that? And do you have the means? Do you have a car that's going to be able to get you to that doctor's appointment in Wichita? Maybe not. So that's when we see that more of these older adults are really starting to struggle with transportation in their later years.
You mentioned isolation, and that's something that's, I think, in a sense, been a little bit overlooked during the pandemic, is just the negative impact. We hear that, the social isolation is bad, but nobody really goes into detail as to why it's bad and how it's affecting people. What are some of the real drawbacks for older adults when it comes to isolation?
Social isolation is one of the biggest risks for dementia and Alzheimer's disease, as well as many other negative health outcomes. So we know that people who are socially isolated, first of all, have that higher risk for dementia and Alzheimer's disease, but they also generally have lower rates of physical activity, a poorer diet, and then because of that, we're seeing a lot more rates of hypertension and diabetes start to spike up. And we'll see that in coming years, and as research comes out about the pandemic. But we have already seen that in previous years when you compare older adults who are socially isolated versus those who are not. And something important to remember is that social and economic factors, which includes one's social network and whether or not they're socially isolated, contributes 40% to your health. So remember that health behaviors, what you're eating, how you're exercising, if you smoke or not, those sort of things are at 30%. But those other factors, how socially connected you are, can really contribute 40% to your length and quality of life.
Another factor is education. How does that come into play?
So education is huge. First of all, do you have parents who read to you and support you positively from a young age? Are you able to go to school? Are you able to go to school without having to work side jobs to support your family, or perhaps raise siblings because you might have a different home environment than what other people do? There's a lot of questions that go into, are you even able to obtain a high school diploma, let alone go on to either a trade school or to a four-year university? And education is huge. It can really determine your brain composition. We also know that the more educated you are, the more likely you are to live a longer and healthy life.
So is there some concern right now then, because you mentioned the broadband issue in rural areas, is there some concern right now about how that may be impacting education as we move through this pandemic?
Yes. So broadband access has been a concern. For example, if you have young kids who are trying to remote learn from home and using those online platforms, that can be a real struggle if that student is unable to access their class or the content that's needed. Maybe they can access it, but maybe it cuts in and out, and it's incredibly disruptive. So if we're thinking of K through 12 students, we see that. We also know that a lot of our university students are having the same struggle with accessing all of their content and material, especially in a live fashion, through either not having broadband internet at their home or not having stable internet.
And I assume socioeconomic comes into play here as well.
Always. When we think about things such as broadband internet. It could be anything, healthy eating, your socioeconomic status, and basically how much money you have, if you have a stable job, and those sorts of things always influences any type of behavior that you're thinking. So if you have more money, you're more likely to have faster and more stable internet. If you have more money, you're more likely to be able to access nutritious and healthy fresh foods, because we know that those are often more expensive than the prepackaged meals that don't have quite the nutritional quality that we're always looking for. So those social and economic factors play a role in almost everything that we do that contributes to our health.
We mentioned zip code, and I'm assuming that there is also some communities that are rated better in terms of quality of life, and I'm assuming that a lot of that maybe boils down to the policies that they put into place?
Yes. So we know that there's huge differences, like you said, in health outcomes compared to zip codes. And that can often be determined by the environment that is within that zip code, but then also the policies that are in place within that zip code as well. So there have been numerous studies and initiatives across the state of Kansas alone that have worked to limit tobacco and alcohol advertising, for example. So it used to be that you would walk into a convenience store and there would just be huge posters plastered all over the place with cigarette ads or alcohol ads. And this is one example where these public health initiatives can work to reduce that marketing message that's so huge and makes us think about cigarettes and alcohol, which then makes you more likely to want to buy them. So these local policies that are often, within your zip code can be huge to determining your health behaviors.
Extension is heavily involved in culture of health, and really a lot of this kind of falls into those areas, maybe not specifically, but in a way it's being addressed.
Yes. So K-State Research and Extension, while we do provide research and evidence-based community education, we are also trying to supplement that by working with coalitions, community partners such as foundations or the public health department, your libraries, those different institutions that are in place in your community to talk about how we can make the community a healthier place. So what policies can we advocate for? What types of projects can we help spearhead or partner with to make our community a safer and healthier place? How can we work with our schools to implement more gardening activities or education on health in general? There's a lot of different things that Extension is doing to try and address this 70% of these outside factors that are contributing to our health.
And a lot of this has to do with research. A lot more research is being done by Extension right now than it's probably ever been done.
Yes, so Extension is heavily involved in research, and one of the main premises of our whole mission is to take the research that's developed at the university and bring it to the people. And the social determinants of health are a huge focus of research nationally and internationally. And at K-State, we have been using a lot of the data that's been developed across the world to talk about how we can make Kansas a healthier place. And we're also doing research of our own. So what policies have we implemented in Kansas that have really made a difference?
We also have a number of publications, and they can go online and just kind of do a Google search for whatever they're looking for, and most likely an Extension publication is going to pop up.
Yes, we strive to have a lot of information readily accessible on the internet. So if you don't have internet at home, go and visit your local library. And whatever you're looking for, type in the topic area in the Google search bar and always add K-State Research and Extension or K-State at the end of it, and our resources are likely to pop up for you.
That's K-State Research and Extension Aging Specialist Erin Yelland. More information on healthy aging is available at all county and district extension offices and on the Kansas State University Adult Development and Aging website, aging.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.